Excuse me, ma'am.
Yes. Coming.
Good morning, ma'am. Hi. Hi, ma'am.
Hi.
I'm Divya.
Oh.
I'm just using a hand wash, okay, hand rub, which is for your safety, okay.
Sure.
I'm Divya. I'll be there till 2:30. I'll be the nurse who is taking care of you, okay. I'll be giving you a room orientation. I'll be explaining about certain things and then fall prevention also.
Okay.
First, I'm just going to give you a put in on the ID band, patient identification band.
Oh.
Ma'am, this is an ID band which has your name and UHID number. This should be there till the time of discharge.
Oh, okay.
We'll
Good.
only come and remove it. Till then, let it be there in your hand. Okay.
Sure.
It is for the patient identification. Okay. Before doing anything, they will check on the ID band and go ahead. Okay. So this is about the fall prevention. So always your call bell is next to you. You can press the call bell. If anything, you please press on this red color button. We'll get an alarm over there. We'll come and attend you. Okay. So anything. And I've kept your specs and the hand sanitizer, water bottle all here. Okay. Your phone is also here. Okay. Anything you can press on the call bells. Don't get up alone. Okay. So take your time while getting up from the bed, okay? Especially suddenly when you get up, you may get a giddiness. That is why you have to turn to one side and relax and get up and sit.
Sure.
Suddenly getting up out of the bed and then walking make you, blood pressure may drop down and you may feel giddiness. That tend to have a fall, then end up with the other complications, okay? Always call the nurses. That is why the call bell is here. Please press on the call bells, especially when you have a giddiness, head lightning, dizziness. Don't try to get up and then walk out and call us. Please be on the bed.
Had such
but,
a thing.
but then I'm just giving you a hint. You may have it since you are on certain medication that is potential to cause those symptoms.
Oh, okay.
So use the right footwear when you are getting out of the bed. Especially, ma'am, loose footwear and all. Even if you are wearing, it may slip down. That may tend to have a fall. Yeah. Even at home, I'm just telling you. Okay, it is a precautionary method so to prevent a fall. Okay. And use well-fitting cloths. Don't wear the long cloth and then loose cloth.
You are giving. I
cannot have that's fine. Choice. Yeah, correct. That is why we are only giving. Sure. At home also, it's better to take a precaution. Prevention is always better than cure. At home also, don't wear the loose and long cloth that may tangle on your feet and then you may tend to have a fall. That's why we are telling you to wear that. Okay. Yes. And then keep the night lamp on. Don't turn off the night lamps, especially in the night time. We will be oning it. Don't turn off the lights. Okay. Anything in the night, you please press on the call bell. We will come and take you to the bathroom. Sure. Don't try to alone get up and then don't try to open the side rails and then get out of the bed, which will cause again fall. That leads to a major complication. This will be yes, ma'am. You may be used to your own cot at home. That will be wide and length. It will be well, setted. But then it is a small cot. One more thing is, since you are in the hospital, you are on certain medication which will high risk to cause and fall.
So always you will be locked and kept.
It is yes, ma'am. I'm sorry for that, but it is yes required. Okay. So don't remove this, and you yourself don't try to make it down. We'll only comment. That is why the call bell is next to you. You can press the call bell. We'll come and attend to you. Okay. So, and then always ask for the assistant when you are going to a bathroom. I'll tell you why. Because when you may be in the early morning suddenly getting up and you wanted to urgently go to the toilet, but then in an urgency when you get out of the bed and then walk out, you may have a giddiness and then you may have a fall. The fall again, you will have a post-fall. It is mentally and physically, financially, everything is stressful. You may have a fracture, internal bleeding, all those things. Why do you want to get into certain trouble? That is why we are precautionarily giving you a education. So okay, so just press the call bell. We are always there. We will come and attend you and take you to the bathroom. Okay. keep these sidles always up. I am always, see, I will keep it, and whoever the attender comes also, tell them not to they themselves remove it and go out of the room. Okay, when we are here, we can remove it.
Anything, if I have to come out, I have to press
Exactly, ma'am. Yes, okay, that is why we are kept up. Okay, take your time, own time to get up. Suddenly getting up, it may be, we may be stable enough. We are thinking that we are stable enough to get up. But then suddenly when you get up from the bed straight away, you tend to have a fall. You may get a giddiness, suddenly your blood pressure may come down a bit. That may cause giddiness and then have a fall. So always try to, that's good for your spine also. When you get up, turn to one side and then get up. So that is also saves your spine. Okay. So that is why you have to turn to one side, hold on to the sidles and then get up. Okay. Fine. And when you're out of the room, when you're walking, this is a caution board where they'll be keeping on the corridors. That is especially when a wet floor, they'll be keeping this caution board. When they have kept this caution board, don't walk onto that side, because that says that there is a wet floor, you tend to have a fall.
So I'm allowed to get up and walk around?
You are being allowed with attenders to walk. Okay, and with a physiotherapist you are allowed to walk. Don't try to go alone on the walking, for the walking. Okay, when you are, especially we are planning for a surgery. You are being posted for a surgery tomorrow. Post operatively you will be on certain medication, and during a surgery we'll be giving you some anesthesia also. The anesthesia drugs will have the certain side effect. You may have a giddiness, tiredness, weakness, your consciousness may be impaired. So that is all will cause a fall.
How long
okay,
it will be after
that will be within
doctor
24 hours to 48 hours. Slowly it will come down. Okay, within 6 hours you will be all right after the surgery, post anesthesia effect. But then that effect in your body will be there for another 24 hours, and post surgery you will be on some medication. They will put on femoral or epidural. That is a medication which is for your pain, to numb. So when that medication you are on, you will have a numbness on your lower extremity. So what happens, because of numbness, you may be thinking that I don't have a pain, I can walk alone, but then that will cause a fall. Okay, why? Because since we don't have a proper sensation on for lower limbs, we will be thinking that we are kept food on the floor, but it may not be, but so that you will have. So be very careful. That is why I am keeping a call bells and then sidles also post operative. So okay, so that's very important. And also when you are getting up, hold on to the walker, walking sticks, all those things. Do not hold on to the wheeling object, even at home. Wheeling object, why I'll tell you, see, if it is an strong the object, it will not wheel off and then move off, so you will not get a fall. For example, the wheeling object, if you are holding, that will also wheel off, you will also tend to have a fall. Now I'm going to take you to the bathroom to explain you about the grab bars and the call bells in the bathroom as well. Okay, I'm sorry, post operatively also it is very important. That is why I'm taking you to there also. Okay. And always when you are getting inside the bathroom, just on that light and then get inside the bathroom. Okay. When you are sitting on the commode, it is very important that you hold on to the grab bars and then sit. While getting up also, hold on to the grab bars. Okay. For example, when you are sitting on the grab bars, you have giddiness, you are not able to get up. Don't get up from there. You be there only, press on the call bell. This is a call bell. You can just pull this call bell, we'll get alarm there, we'll be coming inside. Post operatively, without our presence, you will not be coming to. But now I'm telling you, when you are coming to the bathroom, you make sure that you have a giddiness, then you press immediately call bell, don't get up and then walk out. And also we have a grab bar on the shower area and call bell on the shower area. When you are sitting and taking a shower, if you have a giddiness, if you are not able to get out of the stool, you can press the call bell immediately. Just pull the call bell, we'll get alarm, emergency call bell, so that we can attend to you and take you to the bedside. You yourself alone don't get up and walk out even from the restroom. Okay. Ma'am, you understood everything that
Yes,
whatever
yes.
I've explained about the fall?
Yes,
You
yes,
understood,
yes.
no?
You are very clear. I understood everything, and you have a good smile, Divya.
Thank you so much, ma'am. Ma'am, I will be giving one tool that has some questions. Did you have a fall history? All those things. Just tick it yes or no. It has a marks as well.
Sure. I have to do it.
Yes, ma'am. I will give you that sheet. Okay. So that sheet has a question to you. Okay. It's in Kannada and English both also. Whichever you are comfortable, you
I'm
can
okay
tick
with
it.
it.
English, no? So that you can see here. You have. I have fallen in past
okay,
year,
okay.
yes or no. So you can tick it like that. Okay, this is just to, I will collect it from you later. It is, I don't need to take this form. I just collect the score, how much it is.
Okay, fine.
Okay, you can keep it with you. Any doubt, please let us know that. And when you are switching over the attenders, for example, if you are going and somebody is coming in place of you, let us know, so that same thing has to be explained to them also. So they will also have a knowledge about that. Okay, because always prevention is better than the cure. Once after a fall, it will be very stressful, ma'am. You may have a fracture, internal bleeding. You will be on some of the blood thinners that will cause an internal bleeding. All it is very painful. That's what it's very important to take precautions. And as elders at home also, it is important. Whatever the measures I told, it is to follow. Understood?
Follow your instructions.
Thank you so much. Thank you.